Cervical cancer is preventable, detectable, treatable and curable. Namaste Bengaluru. I am Dr. Rohit Kumar, Consultant Surgical Oncologist at Aster International Institute of Oncology, Aster Hospitals, CMI, Bengaluru. So, why should we know about cervical cancer? What exactly is cervical cancer? Let me go through this. Cervical cancer is the cancer of the cervix, which is also in general language the mouth of the uterus. Now, what is the problem? All over the world, nearly 6 lakh patients are diagnosed of cervical cancer. In India itself, every year, nearly 1 lakh people are diagnosed of cervical cancer. But the problem is not at all that. The problem is, out of 1 lakh people, nearly 60,000 people are dead by that end of the year. This is the problem statement why we need to know about cervical cancer. A cancer that can be prevented, that can be treated, that can be detected very early and you can be cured of. Cervical cancer and HPV infection. What is HPV? HPV means human papilloma virus. Yes, human papilloma virus infection causes cervical cancer. Nearly 95% of the cervical cancers are caused by HPV infection. So, who can develop HPV infection? In simple words, anyone who is sexually active can develop HPV, human papilloma virus infection. If you are having sex with a single partner or a multiple partner, if you are involved in sexual activity for one time or multiple times, all these things can lead to develop HPV infection. So, any person who is sexually active can develop HPV infection. So, does that mean all the people who develop HPV infection will develop cervical cancer? No. It's the same as telling all the people who got COVID infection will die. It's not, right? All the viral infections can be fought by our body's own immunity. So, even HPV virus is also like that. Anybody who has got a persistent HPV infection in their body, that will go on to become a cervical cancer over a period of around 8 to 10 years. This is the time we get to screen and detect if any cancer is developing in the patient as early as possible. The most commonest high risk virus of HPV are 16, 18, 31, 33, 35, 52 and 58. Apart from cervical cancer, they are also responsible for causing 80% of vulval cancers, 50% of penile cancers, genital warts, oral cavity cancers and also cervical cancers. So, HPV viruses can cause lot of genital organ cancers. Be aware to know about it. Cervical cancer, the most commonest cause, HPV virus, because of which the cancer is caused, it can be prevented. So, how can we prevent cervical cancer? It is HPV vaccination, human papilloma virus vaccination. Just like how we all gave COVID vaccination to prevent the COVID infection, similarly we have HPV vaccination to prevent infection of HPV virus. Because of the vaccination, the persistent infection of HPV is prevented and body gets ability to fight the infection. So, what are the types of vaccination? Who should get the vaccination? Now, that is the question to ask. HPV vaccination, the most commonly used vaccine is a quadrivalent vaccine, which has got vaccination against 4 high risk viruses, that is 6, 11, 16 and 18. What is the ideal age for HPV vaccination? The ideal age for HPV vaccination is between 9 to 14 years. It can also go and extend from 15 years to 26 years. The idea is the kids or anybody should be vaccinated before they are sexually active. That is when the vaccination will work best. So what is the schedule? The standard schedule of HPV vaccination is for all girls and boys between the age group of 9 to 14 years. 2 doses, one at day 0 and other 1 month later. If somebody undergoes vaccination in between the age group of 15 to 26, then they will require 3 doses. That is, first dose at 0, second dose at the end of first month and third dose at the end of 6 months. The efficacy of HPV vaccination for people aged above 26 years is not so great. It has to be taken only after discussion with your physician. HPV vaccination is safe. In fact, Government of India in another year or two is going to make this along with the proper national immunization schedule as well. So get vaccinated to prevent HPV virus infection and then to prevent cervical cancer. Cervical cancer can be detected even before the cancer has happened. Is it possible? How is it possible? Yes, cervical cancer is detectable at very early stages or in pre-malignant stages itself. How is it done? That is the principle of HPV screening. As I told, HPV infection persistent for more than 8 to 10 years or for longer years can cause cervical cancer. This time duration that is needed for a persistent infection to then become a low-grade problem and then to become a cancer, this time is utilized for screening. So, what is the screening protocol? HPV or cervical cancer screening is to do what we call Pap smear. Who should undergo Pap smear? What is the schedule? So, all women under the age of 21 years need not undergo any screening. Between the age group of 21 to 30 years, every once in 3 years, you should undergo a Pap smear. From the age of 30 up to 65 years, you can either undergo a Pap smear for every 3 years or you can undergo a Pap smear plus HPV DNA testing for once in 5 years. So remember, don't fear your Pap smear. 5 minutes of your time for 5 years of peace of mind. Get screened with cervical cancer screening by Pap smear. Cervical cancer is treatable and is curable if detected in early stages. So, what all is involved in treatment of cervical cancer? Any patient who is diagnosed with early stages of cervical cancer can sometimes undergo even fertility sparing surgeries also. So, 3 modalities which are used for treatment of cervical cancer are surgery, chemotherapy and immunotherapy and radiotherapy. We at Aster CMI Hospitals, Aster International Institute of Bengaluru, we offer robotic surgeries, fertility sparing surgeries for early treatment of cervical cancer. Along with that, we also have a good multidisciplinary tumor discussion to plan the treatment for advanced stages of cervical cancer, which will involve chemotherapy and immunotherapy, the best of available for treatment of cervical cancer. And also, when it comes to radiation, we have the complete package of doing external beam radiation and also interstitial brachytherapy. which is a very essential component of treating cervical cancers. So remember, don't let the cervical cancer stop you. Prevent cervical cancer by vaccination. Detect cervical cancer earlier by pap smear. Treat and cure by the combination of treatment offered at Aster Hospitals, CMI, Bengaluru. Remember, get vaccinated, get screened, and then it's time to end the cervical cancer. Thank you. This is Dr. Rohit Kumar, Consultant Surgical Oncologist, Aster CMI Hospital, Bengaluru.